Good day. I'm Irvi Patel, Senior Director of Quality Improvement at HCA NCAL. Today, I'm joined by Tina Sandri, Chief Executive Officer at Forest Hills of DC. Under her leadership, Forest Hills of DC has over 86% of their workforce vaccinated, and these numbers continue to grow. Tina, thank you so much for joining me on this quick call today to discuss some strategies that have been successful in increasing vaccine confidence amongst your staff.
Hi, Irvi. I'm so pleased to be here to share our team's experiences, to perhaps get other teams' creative energies flowing to create abundance and protect the health of our communities. So thanks for having us here.
Of course. As you know, the COVID-19 pandemic has had a disproportionate impact on older Americans living in long-term and senior care facilities. The average age of residents in these facilities is 85 years old, and almost every one of them have an underlying health condition, if not at times multiple chronic conditions. And according to CDC data, the risk of mortality in individuals over the age of 85 is 630 times higher than that in the population that is between the ages of 18 and 29. And so the COVID-19 vaccines are a really significant step in combating the spread of COVID-19 and the resulting morbidity and mortality. In fact, recent studies have shown that infection rates in nursing homes are declining at a much faster rate than in the general public. And in fact, those nursing homes that have completed their vaccination clinics compared to those nearby that have not have seen a rapid decline in COVID-19 cases. Having said this, the CDC has also released some data showing that uptake among nursing home staff is only 37.5%. This suggests that the long-term care industry is struggling to increase vaccination uptake among staff members. So putting this in contrast to the benefits of vaccination, one of the things that HCA and Leading Age have done is we set up a target of getting 75% of the 1.5 million nursing home staff members vaccinated by June 30th of this year. And of course, your organization has already surpassed that goal and, are well on your way to even higher numbers of staff vaccination. But we really wanted to sort of take an evidence-based approach to help provider organizations get to higher rates of staff vaccination. And so what we did is we partnered with Brown University to identify some effective practices related to staff vaccination rates. So to identify this, we took some facilities with low vaccination rates, some with medium vaccination rates, and some with high staff vaccination rates in each state, and we surveyed each of those organizations. And through this activity, we were able to identify those strategies that facilities in that high vaccination group, such as your own, really incorporated into their practices. And what our survey results showed was that providers with high uptake were more likely to employ multiple strategies to promote vaccine uptake. And I think this really speaks to the fact that vaccine hesitancy is something that's complicated. It's something that ranges from, I'm really worried about the speed at which the vaccine was developed, to concerns over the safety or the side effects of the vaccine, to deep-rooted distrust in the government, public health, or other institutions. And so because of this very complicated nature of vaccine hesitancy, it's important to really, as providers, be aware of what your staff's specific concerns are with the vaccine, to be aware of whether or not anyone is actively discouraging staff members from getting the vaccine, and to really employ communication strategies that are frequent, targeted, and personal. Having said that, I'm curious from your experience how this information resonates with you and what kinds of communication strategies you all found meaningful.
Yeah, thanks, Irvi. So yes, everything that you were saying is what we experienced here as well. It takes definitely a multi-pronged approach, similar as we would in senior living with a resident with complex comorbidities, to approach it from lots of different disciplines. And that's kind of how we looked at approaching our vaccination program as well. To start off, our initial fork in the road, if you will, was to mandate or not, given that the EEOC had allowed us to mandate as of last December. However, we decided with our workforce, given everything that they've been through 2020, and I'm preaching to the choir, to the listeners of this call, or this webinar, that our folks have been through a lot. They've really been through a lot in the past year. And using a principle of trauma-informed care, we decided that we wanted to empower our workforce to maintain as much control over that decision on what happens to their body as we could allow them to do. And because we wanted our team members to work for us and with us, not out of fear of losing one's job or not complying or quitting due to a mandate not feeling comfortable to them during a nursing shortage or other type of staffing shortage, also didn't quite feel right for us. We applied our corporate values of compassion and respect as we were developing our communications strategies. And those became sort of the lens through which we looked through everything, as opposed to, say, using cost or national or state goals or risk management perspectives. We used compassion and respect. And we handled each person's point of view as a person-centered care concern, if you will. We set a goal in our communications, not necessarily of being at a certain threshold with our vaccination program, but to reach everyone with knowledge. And we felt that knowledge was power, and we wanted to empower our workforce. We felt that they were grown people that could make decisions for themselves if they had the right education and information. So our approach to education was multi-pronged. If it was important enough to say in a week, we try to say it 8 different ways. So that could be through email, phone call, text, poster boards, flyers, little slips of paper that got handed out, a 60-inch screen TV that looped a video, playing videos in the day rooms, even for night shifts, so that they could see videos of communications. We would have huddles, one-to-one meetings. I personally helped a lot of our staff upload certain videos that would address whatever concern they were curious about, so they could watch it by themselves in the comfort without feeling pressured and consume the information in whatever way they felt was good. But one of our big challenges was to find a way to explain things in a language that was acceptable and understandable to much of our frontline workforce. For example, what is messenger RNA? And we wound up having to use an analogy. For example, if you're making bread, bread includes egg, and egg is a protein. So when you're talking about COVID, it was a way of providing an analogy of what is that protein spike and how is the messenger RNA or the recipe for the vaccine impacted. And knowing if you've isolated that protein, if you've isolated that egg out of the recipe, you can't get COVID, and there's no COVID in an egg per se, right? And so having to break down things into other analogies was an important thing for us to consider. We also looked at peer ambassador. We were fortunate that one of our staff self-proclaimed, if you will, self-made himself into a COVID ambassador, and we totally ran with it and supported him and gave him whatever resources he needed to do with that. It was his passion to help keep his coworkers safe. He saw the impact of COVID, didn't want his community hurt, and wanted to go out there to protect people. So we were fortunate to have that as well.
That's amazing to have someone that's a self-appointed peer level ambassador. And, you know, it really speaks to the fact that engaging someone on the front line or another influential staff person in the organization to encourage and share information with others is really important. You know, staff want to hear from their peers. They want to hear from respected healthcare professionals because they want to get the facts. And so that, I think, is really helpful. I think the other thing is, you know, yes, they want to hear from these individuals. And of course, communication methods matter. But what also really matters is the message that you're putting out there. And so, you know, in the survey, what we found was that while providers generally tend to focus on messages of keeping yourself safe, keeping your family and your coworkers safe, those that had higher rates of uptake would also share messages of resuming activities such as visitation, getting back to normal, going into public spaces at a much higher rate than facilities with lower uptake rates. And so they sort of focused on this positive aspect of getting the vaccine. What was your approach in terms of communicating the positives of getting a vaccine?
So we did want to focus on what was going to be positive for each individual employee as opposed to what was positive for the organization. And we really tried to meet people where they were. But like you were saying, we talked about protecting you, protecting your loved ones, and those who might be immune compromised people in your circle that might inadvertently catch COVID if you were to transmit it. We communicated and shared news stories that said those who were fully vaccinated may be welcomed back soon into restaurants sooner than those who had not been vaccinated, as we've been seeing in news stories and other public venues, recreational venues. I know our workforce would like to get back to having free time in the community to mix and mingle. Fully vaccinated persons would be able to visit with other small groups without having a mask or have social distancing. And we've kind of seen that come true recently with some of the more CDC guidance, subject to state interpretation, but it's on its way. Fully vaccinated persons would also likely be able to fly globally with less rules and restrictions, is what we were hearing. That pre-flight COVID testing, quarantine requirements and such, once at your travel destination, might be lighter if you were fully vaccinated. And given that 87% of our workforce are people of color, mostly Black, African Americans, or Africans, that we have a lot of our workforce who do have families globally. And this was a particular message that was very well received by the workforce when they were thinking about what it would take to get back to their families and go visit them, not have to quarantine when they get there, and possibly eliminating some of the quarantine down the road once they get back home here, which translates to work days and income in your pocket.
That makes a lot of sense to me. I'm also sort of curious on your approach to celebrating staff who get the vaccine. One of the things that the survey showed was that there is value in celebrating staff. And so what was Forest Hills of BC's approach to creating that celebratory atmosphere?
So we had a wonderful team. We engaged our employee morale group. We had cheerful atmosphere during the clinics with music, light snacks, selfie picture props, paper dolls where folks could write short testimonies on why they wanted to be vaccinated, and then we strung them up for others to see. So there was almost public testimony that way. Again, no one was forced to do anything. This was very cheerful, and people were happy to do that. Everyone who got vaccinated made the choice. We didn't make it for them. And during the stage of COVID, where so many have had our liberties put on hold in many different ways, it was good for people to feel like they controlled this part of the pandemic within their own power. And one of the principles of trauma-informed care is giving choice and control over situations. And COVID has certainly been traumatic for many people. We'd also put out I got my shot stickers on for employee badges, similar to I voted or I got my flu shot stickers. And people were pretty happy to get those as well. We have a Healthcare Heroes wall where we were taking pictures of people as they were getting vaccinated with their consent and putting them publicly on in a collage in our main lobby. So even though, especially in the January clinic where things were really shut down still and people weren't coalescing around water coolers, people could still see, oh, there's so-and-so, they got their shot. Let me go talk to them, call them, and we email them and ask them, how did it go for them? So there was that peer-to-peer conversation ability and just feeling not alone, because if you got your shot and went back to your workspace, you wouldn't necessarily know what was going on in another department. And it helped create positive community. This was also a different way of getting the message out to our visual relational learners. Also next month, our board of directors is coming on site to pin staff with Healthcare Hero pins as part of our celebration of National Older Americans Month. And this allows our board to engage in a way in our community that they've not been able to because they've not been able to come in to the buildings in the past year. And as the weather turns nicer, we'll certainly have a nice cookout luncheon for all of our team members outside when the weather's a little more predictable in the DC area where we are. And then finally, as a mode of celebration, we have had the opportunity to have some external sharing of our resources, just like I'm doing here today, of what we've been able to do to hopefully help other folks along the way, better to leave the industry a little better than the way we found it, I guess, and contribute in that way. But we also have our self-made peer ambassador had the opportunity to participate in a national town hall with the Black Coalition Against COVID. And so he was on a panel with White House, CDC, historically Black colleges and universities, the Black Nurses Association, and other organizations to talk about the successes that we've done here. And we were able to highlight that on our social media, put posters up saying, way to go, and really just cheer him on this little bit of fame and in that way. And it told our staff that people are empowered here to have valuable contributions of ideas that may be beyond their typical day job, and that we really value that.
What a great way to show value for your staff and to live up your values as an organization of compassion. Thank you so much, Tina, for sharing your experience with us. You know, to me, it's clear that providers need to work collaboratively with their staff in their efforts to increase staff uptake. I think that there's many different strategies that an organization can employ. And really the important thing is to respect staff members and provide them the information they need to make their decision of getting vaccinated. So once again, thank you to you for sharing your insights with us. For our audience members, don't forget to check out our website for additional resources and ideas on increasing confidence in the COVID-19 vaccine. Thank you.